I am Keith Desterick. I'm with the Cure Starts Now and the DIPG DMG Collaborative. We appreciate you joining us here this morning to talk a little bit about your grant and your project here. We have a couple of folks with us to walk through that grant with it. And if you don't mind, I'll kick it off with Al Musella from the Musella Foundation.
I know Al. Hi, Al. Good to see you.
Good to see you. I'm Al Musella from the Musella Foundation for Brain Tumor Research and Information Incorporated. I'm a foundational member of the DIPG Collaborative, which is a group of 26 independent foundations who are working together to speed up the search for the cure. Before we get any further, I want to just tell you that the DIPG Collaborative has funded your project in the amount of $198,436 for the project Phase 1-2 trial of Exoblate Sonala 001 in pediatrics with a focus on DIPG.
Thank you so much, Al. It's wonderful to hear. Yeah. Oh.
Good luck with the project. This is one of my favorite therapies. Aside from the chance that it's going to be a cure, this is one of those things where it's easy to do and not that tough on patients, hopefully. My sister-in-law, who died of glioblastoma, always told me she wants me to find her a cure and one that doesn't hurt. And this might actually fit the bill. This is one of the most exciting technologies I've ever been involved with. And so good luck with the project.
Oh, thank you so much for those kind words, Al. It took me 30 years to get here, but I have been working on this for about 30 years.
I'd like to introduce you to John McIntosh from the Cure Starts Now. John?
Thanks, Al. Hey, good morning, Dr. Marcus. Congratulations. And I run the Mass Rhode Island chapter of Cure Starts Now. Been involved with Cure Starts Now for about 8 years since my daughter Nicole passed from DIPG. And during those 8 years, you know, we worked hard with Keith and the rest of the chapters to do our best to raise funds for inspirational work like yours. And I've seen us fund, you know, a pretty comprehensive strategy, looking for agents, looking for delivery methods, mouse models, all kinds of stuff. I think what really excites me about your work is it's pulling it together, and it's going to be a trial that families can look to and participate in, and honestly give the whole community hope. So it's great to see it translating and come together into a trial, and I wish you all the best success. And let me hand it over to Melissa from our Round Rock chapter.
Hi, Dr. Marcus. I'm Melissa Fleming from the Austin Round Rock chapter of the Cure Starts Now. Vicky Brudier and I actually got to meet you a few weeks ago when we were out in DC, and learned a little bit more about your device. And I'm very excited to be a part of this and be able to help combine the drug with the device. And, you know, my son battled for only 7 months when he was 7 years old, and he wanted to kick cancer in the nuts. And I feel like you're going to help us do that.
Yeah, I just want to say that working with children with the IPG has changed my life for the better. And I think it's also the scariest thing I've ever done. I've treated a lot of adult patients with cancer in my life. And this, sitting there watching a brainstem, watching the neurosurgeon target the brainstem with our device, and after having been given our drug. Mind you, we treated 9 glioblastoma patients with Phoenix, half of their tumors, and there were no side effects. But somehow when you treat a brainstem, it's very scary because no one's, you know, ever had the confidence in their therapy to treat, you know, a complete half of a brainstem. But I am happy to say that one of my greatest moments was when the patient woke up after anesthesia and within 3 hours was eating a pizza and dancing in the PICU, literally dancing in the PICU. That made everything worthwhile. So, you know, this therapy has been designed over 30 years. It just took that long for the individual pieces to come together. So thank you. Thank you. It's been a really, really long journey. But we're hoping, yeah, we're very hopeful.
we're very optimistic to see it go forward with it. We'd love to have obviously the updates from you on it. I think one of the things that we try to share not only with our collaborative members, but also our supporters of our various charities, because this is 26 of us independent foundations that come together for this one, is a quick synopsis, roughly 2 minutes or less if you can, of what makes this trial different, and why you think that, and frankly, why you've invested as much time and effort into it.
What people should know about this is that it's a simple procedure, that it has no known side effects at the moment, and that I can now say that we've treated half of a brainstem and a whole brainstem. The promise of this therapy was seen with glioblastoma. We treated 9 patients and there have been no side effects. But glioblastoma has been known to collect our drug very well, because people use the drug as a visual beacon under fluorescence to identify glioblastoma. Because the DIPG usually is not resected, a surgeon won't go near the brainstem to take it out, and the cells are intermixed with the normal cells diffusely. There was a big question as to whether or not this drug actually would be accumulated by DIPG. That was the biggest question. And I'm very happy to say that that question was answered by our collaboration with Javad Nazarian's group in Zurich. As you know, the Children's Hospital in Zurich is one of the leading DIPG research centers. And we contracted with them through Children's National and Dr. Packer to investigate tissue cultures of from children with DIPG and test to see how well the DIPG cells took up our drug. And I'm very happy to report that during that year that they were working on this project, they discovered that the DIPG cells are actually more active at taking up our drug than the control, positive control rat glioma that was the model system. And the rat glioma, we know, can be cured by or pretty much triple the life expectancy after a single treatment. That rat glioma can be, the life expectancy of those animals could be tripled by using our drug, or more than that, because we actually didn't find the limit of life expectancy after treatment. So the work done at the University of Zurich by Javad Nazarian's group really gave us the confidence to proceed to the FDA with this clinical trial. That's what makes it different from any other clinical trial I've ever done. We've known the drug accumulates in glioblastoma. We were hoping it would accumulate in DIPG, and it should, because it accumulates in very fast growing brain cancers. And so DIPG is the fastest growing brain cancer. And it proved, so the hypothesis worked. It was correct. And we were able to target the DIPG.